that this meeting will be recorded for those that did not have a chance to attend. And I wanted to give a little overview of what are some of the things that we're going to cover today. We're going to have brief introductions. We're going to talk a little bit about us, who CarePaths is, and what is this new app that we've built. We're also going to be covering why did we build the CarePaths Connect app. We're going to have a demo of the patient experience of the app so you can get to see the app in action. We're also going to be discussing how exactly this new app is going to benefit your practice and how you guys can start using the CarePaths Connect app. Towards the very end, we're going to be announcing a special offer and having a brief question and answer session where you can either ask questions about the application or just give us your honest opinion and feedback about the app. Like I mentioned before, this meeting is being recorded. And for the question and answer session, for people that are new to Zoom, there are a couple of ways that you can do this. If you hover over your Zoom screen, there's going to be a chat bubble icon in the lower part, kind of around the middle of your screen. You can click that chat button and it'll open up your chat window. Right now, the setting is enabled for you guys to only be able to send us questions. We'll be collecting them, and then we're going to be reviewing them towards the end of the session. Another way that you guys can send us questions, if you click the participants icon in that same location, roughly around to the left side middle of the screen, you click participants, you're going to see CarePaths Inc. As the host. That is myself. You can double click my name and you can send us your questions via the chat. And again, we'll be collecting them and answering towards the end of the webinar. For presenters today, we have Barrett Griffith, our president and COO. You guys have myself, Gerardo Osorio, Chief Operations Officer of CarePaths, and we also have Maureen Hart, one of our founder and board members of CarePaths. Barrett, please take it away for us and show us what we have in store.
Thank you, Gerardo. For those of you that I haven't met, my name is Barrett. I've been working with CarePaths technology and executive teams for the last 3 years to continue the mission of CarePaths that Maureen and Jeff started 2 decades ago. CarePaths is a mission-driven company. We're committed to supporting psychiatry and behavioral health with technology in the modern and dynamic health landscape. And we're provider-centric. We've grown CarePaths based on your feedback and research in the field so you can work towards better patient outcomes. And CarePaths Connect is our newest offering, an app to increase engagement with your patients. The digital front door app is integrated with CarePaths EHR and practice management solution, so your workflow doesn't change. And additionally, CarePaths Connect works for you by showcasing your practice in online directories. So CarePaths Connect lets you meet patients where they're at and brings them into your CarePaths EHR. Your patients are already using mobile as the means to seek treatments and find providers, similar to ordering food online. Providers' websites are becoming almost a thing of the past as millennials and Gen Xers are finding their providers through mobile apps and social networks like Facebook, Instagram, and TikTok. But as professionals, you know the best outcomes in behavioral health are often based on strong initial bond and therapeutic alliance over the course of treatment. And CarePaths Connect makes this easier. To get more specific, CarePaths Connect assists in expedited access to behavioral health. We want to help patients find you online, handle paperless patient onboarding, and offer a real-time self-serve calendar so patients can self-refer. CarePaths Connect also assists in enhancing the initial bond with patients through asynchronous chat and teletherapy sessions for intake. Additionally, CarePaths Connect assists in supporting patients with follow-up care through reminders and assessments for measurement-based care and transition of care. So it's time for the patient demo. And as you'll see in a second, this is what we've come up with for a digital front door for your practice. In this case, we have a therapist, Molly Mills, licensed clinical social worker at Outback Counseling and Psych. We provided a link that Molly could put on her social media page or on her practice page that lets patients quickly message them, check their insurance, or reserve an intake or a follow-up appointment. We feel it's important to present some pricing information up front for patients, as one of the challenges that it can defer patients from seeking therapy if they're unsure of the costs. So we're able to show, based on your CarePaths EHR payers, what in-network services you offer, and come up with an estimated price. Additionally, a patient can go in and search their own eligibility information. And they'll be able to get some information back that lets them know about how much it would cost them for copay once they've met their deductible, and an idea about the number of sessions that they would need to complete before their insurance would take over. So as we mentioned before, we make it easy for patients to come in and reserve their intro appointment. Okay. Where to capture some personal information, who we might contact in the case of an emergency, and some demographic information about the patient. Because you set your fees, we ask them to agree to your fee schedule. And then we follow up with a PHQ-9 instrument. So you have some more data from the patient when you first see them. So the patient will be able to start communicating with you at this point. And in your CarePaths EHR, you'll be able to view the patient that came in. Okay, the appointment that they wanted, and accept the referral. And we'll be able to see the message. The patient will be able to see your messages in real time as well. I'm going to go in here and you're going to accept the referral. At this point, the patient will get a password to log in, emailed to them. And they'll be able to start their teletherapy session. So that really wraps up the patient onboarding experience. You can see you have a nice, quick communication with the patient from the start. Easy self-serve calendar, and a calendar and a link that can be available and linkable from your current websites or any other marketing material that you're currently using. So at this point, I'd like to hand it over to Maureen to talk a little bit about the benefits of CarePaths Connect for your practice.
Okay, I'm going to talk a bit about how we think this is going to help your practice. The first area is administrative, and obviously if a patient is creating their own account and scheduling their appointment. That means somebody in your office doesn't have to be spending time on that. Also, with the eligibility verification, the patients will be entering the information, and you and the patient will be able to see what their insurance is going to cover. This allows you to address any payment issues up front, and it also makes it easier to collect payment at the time of service. We also automate standardized automate measurement-based care. Say you want to monitor the patient's progress with the PHQ-9, say every 2 weeks. You just set that up at the beginning, and then the app will ping the patient when it's time to complete an assessment. So once you've set up the protocol, you don't have to worry about it. Then in the clinical area, now obviously we haven't launched this product yet, so we don't have kind of empirical evidence of benefits, but one of the things, we have some ideas about what the benefits will be, and one of the things we're going to be doing is collecting data so we can evaluate these benefits. We're also going to be working with Bruce Wampold, the author of The Great Psychotherapy Debate, who will be helping us kind of develop clinical research projects. But some of the benefits we expect are that when a patient self-refers and self-schedules, they'll be more likely to follow through. Another benefit that we expect is that patients that use secure text messaging to deal with kind of emergent issues before they start treatment or in the process are going to show some benefit. We'd like to involve clinicians, real clinicians like yourself, to help us evaluate this clinical benefit. So if any of you are interested in kind of being on an advisory panel that would help us look at our research questions and also help us shape the app to make sure it's really doing what we want it to. If any of you would like to volunteer, you can just send an email to marketing@carepaths.com and we'll get in touch with you. Now, the last area I want to talk about is kind of the behavioral health care marketplace and some of the risks there. Behavioral health IT is a very hot area for investors right now. Platforms that connect the care seekers with the providers like Lyra Health and Talkspace are very popular and rapidly growing. It's kind of the Uber model applied to behavioral health. They make it easier and cheaper for the patients who are seeking services. They also bring more patients to the providers. Those are the good things. On the negative side, these platforms reduce provider autonomy because they're trying to promote themselves in the marketplace as brands, and they try and get all their providers to follow a similar protocol. They also reduce the reimbursement to providers and take 30 to 50% of the insurance reimbursement. The basic strategy of these platforms is to try and achieve a monopoly or market dominance so that they can then reduce costs and increase their profit. And by reducing costs, we can expect that they're going to reduce provider reimbursement, limit patient care, maybe use digital self-help tools in lieu of professional treatment. Basically, the fear is that they will do things for profit reasons rather than without too much regard for patient benefit. But with the CarePaths Connect CarePaths Connect means that providers can offer patients some of the same tools that make it easy to find a therapist and schedule treatment with a therapist. Independent of these Wall Street-backed platforms, therapists can now use CarePaths Connect and offer the same thing without compromising their autonomy or reimbursement. It also means that local groups of clinicians can use CarePaths Connect to compete with these national platforms. This can work because health plans, employers, physician groups can leverage the good reputations of the local clinicians in their own marketing. And well-regarded local clinicians are a more powerful marketing tool for them than the reputation of a national platform that's managing everything from some remote part of the country. Okay, that those are the highlights of the benefits we're expecting. And now I'm going to turn it back over to Barrett.
Maureen, thank you so much for giving us some of those market highlights. So the question that I'm sure all of you have is, how do we start using CarePaths Connect? Now, we're easily targeting the end of October to have this feature available. You'll be able to see in your EHR dashboard link to simply activate the digital front door app in CarePaths Connect. Additionally, in November, we'll be following up with directory listings, and that's what we can expect. So I'm going to give you guys a quick demo now of what it's gonna look like when you are signing up and creating your front door. So like I mentioned, you'll have a link in your EHR dashboard that'll bring you to a page like this. And you'll just use your same login access that you've been using before. Give me a second. Oops. Okay, so this is the form that you'll use to create your digital front door. You'll be able to upload and add an image for your profile. You'll be able to set the message that you like and optionally show it on your digital front door or have it be included in your online directory listing only. You can update and change your rate at any time. Let your visitors know if you offer a sliding scale or not. You can go in and set your help areas and the therapy types that you work with. Call out your licenses and any other final closing you'd like to give. For those of you who work out of a physical office, you can go ahead and add your location. When the patients are following up with their appointments, they'll be able to easily link to your address if they don't know it already. And as we showed before, all you need to do is go into your CarePaths schedule and set a time as open right here. And you'll be able to additionally set recurring appointments so your patients can, so the time will be available for as many recurring weeks as you'd like. And from here, you'll simply save your settings and you'll get a personalized link that could be used, added to your social media accounts, added to your practice websites. And as you see, it's the same link that we looked at before. So that's how it all ties together. And like I mentioned, this is the link that will be that you can share on your profiles. Additionally, in November, we'll be working up directory listings. So in addition to having the site, having your profile on your own site, you'll be aggregated with other users of CarePaths Connect. So people can find you through CarePaths main site and through other online directories. And that wraps up the demo about how we'll start using CarePaths Connect. And I'd like to hand it over to Gerardo to talk a little bit about special offer and the cost.
All right, so thanks Barrett and thanks Maureen for your help covering the demo and those important topics about the application. We've had a few stragglers join in the meeting a few minutes late. So guys, if you didn't start at 12, this meeting is being recorded and we'll be sharing the recording afterwards so you guys don't miss anything that we covered during the webinar. So this new mobile app, the CarePaths Connect app, is going to be free for every single CarePaths EHR user at the time of launch. So everyone in this webinar who's currently a CarePaths EHR customer will get this app as part of their subscription at the time of launch. And if you're not an active user of CarePaths EHR, if you just found us online and are interested in this application, remember you can go to carepaths.com and you can sign up for a free trial account today, free for 30 days. We don't have any commitments or cancellation fees or anything like that. And you can do your diligence, checking out the EHR and also checking out this new app that we're going to be launching in October. About our special offer, we're excited to share those details with you guys. CarePaths throughout the years has grown tremendously by your provider word of mouth. Most of the referrals that we get, not patient referrals, client referrals from other providers, are actually people that say, hey, look, I use CarePaths EHR in my practice. You just got your license. I think you should check it out. So we definitely appreciate everyone that puts in a good word about our software. And we felt that it's time to start giving something back. This new affiliate program is meant to reward clinicians who send over their colleagues to CarePaths EHR and successfully register for an account. Under the program, you can get $50 for every private practice or individual practitioner that you refer to us successfully, or you could get $100 for group practices of 5 providers or more. And we feel this is a pretty straightforward, easy, simple way for you guys to get some extra cash that you can reinvest back in yourself or in your practice. If you have any questions about this affiliate program or anything in regards to pricing, I'm going to put our email again in the chat, which is marketing@carepaths.com, which is where you can send those inquiries to. And then it's time for our question and answers. We've been getting a few questions as the meeting has progressed. So I'm going to let Barrett and Maureen answer these questions. Barrett, the first ones are actually related to password and security. I know that's something extremely important for us in the healthcare field. First question is, will we create the password for the client, or will they be able to make their own password from the start?
Great question. The initial password will be set and emailed to the client, at which point afterwards they can change it however they like. Yep.
Okay. Another question in regards to password, is the password automatically sent, or do we have to send that to the client? And I think you answered that it's going to be automatically sent. Is that correct?
That's correct. Yeah, I simply went in and changed it manually because the one that was emailed would have been random.
Okay. Next question we have is about secure text messaging function. I know we didn't spend a lot of time on that. We briefly recapped it. So can you give just another quick recap on how this secure text messaging option kind of complements the function of the application, and what are some use cases that providers can use this for?
Sure. This is a new feature that's going to be part of CarePaths EHR. Go back to the home page, and it'll be a list of your most recent patients, or the patients who have started to communicate with you. And if you use something like Google Hangouts or Facebook Messenger, you've got the ability to send asynchronous text messages back and forth. And good use cases might be giving a warm introduction as soon as somebody's set up and sent the self-referral to you, to ask any questions that they might have, help them get ready for their therapy session or follow up between sessions regarding, just scheduling problems or scheduling issues or other parts of their treatment that you can integrate with it. We haven't demoed it right now, but we have the ability to do, as Maureen mentioned, measurement-based care, where you'd be able to set, say, a battery of different instruments you'd like your patients to complete at, and the time frame that you'd like them to complete it in, if it's weekly or every 2 weeks. The chat could be a way to, call up, comment, and let them know you've received it, or follow up with them between sessions.
All right, the next question is about the topic of scheduling. Will it be an option to not have clients self-schedule?
That's totally doable as well. You just wouldn't set any open times in your calendar. And you could use, for example, you could present the message about yourself in your front door, and the patient would still be able to check their insurance information and start a conversation with you through the message button.
All right, that covers it. So another question we have, so once patients log into this application, are they going to have access to their records?
This app is really for communication and having the appointment. We're going to be following up with payment credit card, where they connect to their credit card, and eventually they'll be able to see their records. But we want to keep this for communication and highlight that we still provide the CarePaths patient portal, and they'll be able to link and get to that from the app as well. But it's probably not going to be included in the app to start. They'll be able to look at their records through the patient portal.
All right. We have a few more questions here. We have a provider that says, I have a specialty practice. I am wondering how an incoming patient would know this, or how could I know if they are appropriate for my practice? Is it possible to add additional questions in addition to the PHQ-9 on an individual practitioner basis?
I think it's possible, yep.
So someone was asking about links on the website, Barrett. Can you expand a little bit when we meant you can put a link for this digital front door on your website for patients to find you?
Right. This might be a replacement for your contact, your contact form. If you're using contact forms, or if you have another way for people to schedule an appointment, this could have replaced that essentially. It could get embedded in your website as well.
All right. The question that we have here is, can this be used for current clients in order to check their benefits? We check our benefits before each client starts seeing us, as well as at the beginning of their insurance plan year. Also, it would be good for current clients to use to get pinged to complete assessments without having to log in to the web page.
Okay.
So I guess there's two questions there. Would it be good for current clients to get pinged to complete assessments? And I believe once patients download the mobile application, Barrett, it will send them mobile notifications for them to complete assessment or access any important account notifications. Would that be accurate?
Correct.
Okay. And then can this app be used for current clients in order to check their benefits?
Yep, they will be able to use this.
Okay. The next question we have is about calendar integration. So will this app sync with any other calendar apps?
Right now, it's only syncing with the CarePaths calendar.
Okay. So next question. Currently, I have an office manager / receptionist for my group practice who handles initial calls and verifies insurance. Would this app be appropriate for a non-clinical office member or solely for an individual therapist? That is a great question.
It is a great question. I think it would serve your non-clinical worker as well. We would just need to make sure that they would be able to receive the referral, accept the referral, and have any follow-up chat messages with the patient?
Okay.
That's a great question.
We have another one. Just to refresh a topic that we covered earlier. So when a client sets an appointment through the app, does the therapist accept the appointment, or is the appointment put into the provider's schedule, let's say, automatically?
I believe it's put in there automatically. We might have, there might be a step for confirmation as well.
Barrett, are you saying that the appointment is put in automatically for an existing patient? Because I know they're accepting the new referrals before the new referral gets in there.
Right. So they're accepting the new referral, and that will set their first appointment. Other appointment requests will need to be confirmed also.
Oh, okay.
Okay. Another question about an existing CarePaths EHR user. So can our current clients sign up and manage their own accounts and passwords, or do we need to add them to it?
They'll be able to manage their own. We'll be able to invite them, and once they're invited, they'll be able to update their password.
Okay. About the topic of text messaging integration, it looks like this is a hot topic. We have a lot of questions about texting. We want our current clients to be able to use the features rather than having to log into the web-based page and send messages. Is that possible? Will those messages go to their chart? So I guess, can people use like just the normal texting app in their phone as opposed to sending those messages via the app?
Right. After a patient interacts with the app for the first time, the next step for them would be to download it. This was just a web-based version, but we have the option to download it. The app will be available in the stores in the app stores for iOS and Android at the time of launch. So the next step would be for them to download the app so they can have use their downloaded app on their phone as the connection to see their reminders, and any messages you send back and forth with them would be added to their chart.
All right. So I have a combo question here. There's 3 separate questions, but I think they're all touching the same topic around intake. So how will we point them towards the intake forms? Can these intake forms be customized? On a related note, will clients be able to access and fill out the intake paperwork on the app when setting up the appointment? And can those questions be customized? So maybe let's recap a little bit how that onboarding process works and what are some of the things that providers can and cannot customize during that intake experience.
Right. At this time, we only are accepting the demographic questions and the PHQ-9. We'd like to explore. This is it is great to hear that you guys are interested in this. So this would be an area for us to explore on how to pull in your intake forms and make them available. This would be an area that we would definitely be working on over the course of the year.
Okay. We have a couple more integration related questions. So would the messages exchanged through this application be saved to the patient's record?
That's correct.
Okay. And then on a related note, in terms of login and security, is the app and the EHR separate? And by that, separate accounts, separate passwords, or is it one single login to access both the app and the EHR?
It's one single login to access both.
Okay. We have another provider asking about intake-related processes. So when clients self-refer, we can add information about the nature of our program and criteria. Could we, within the app, ask clients to self-scan documents, such as a court order, if a court order was the source of the referral?
Not at the time of launch, but we do have an additional messaging inbox that the patient can send through that'll be available shortly after launch. And through that, they'll be able to add their normal uploaded documents.
Okay. We have a few more questions here. The client can check their own benefits. We got that, but can the staff use it as well to check on benefits for a client? I think we touched on this a few moments ago, Barrett. And yes, any non-clinical staff member of the practice could, in theory, use that benefit verification tool.
Right, and that's actually part of the EHR right now.
Okay. We have two more questions here. Regarding the answer to the question about a non-clinical worker or a staff member, how exactly would that be done? I'm guessing, how can this non-clinical person have access to the application? Do you sync with the admin's phone number, any particular email? Let's kind of expand on how a non-clinical user would use the app.
Sure. I believe we would just expand who would get to communicate with the patient over chat. Because right now, this is how, this is the new part of eRecord. So we would just make sure that you would define your staff members you would like to have the ability to chat with your self-referred patients. And I know every office is a little bit different. So if you have particular questions about scheduling and who sets the schedule, I'd love to, to find a little bit more about how you handle those workflows in your office to make sure that we're covering all of our bases. Right now, I know it's the current logged in therapist who's setting the calendar here, but I know we have additional staff who can manage it. So that's a great question.
All right, and then we have our last question. When patients check their benefits, normally when checking benefits, they ask if the services will be held in office or in an inpatient location, or in network or out of network. Does the app have options to check what type of clinic we are, and if we are in network with a particular insurance?
Mm-hmm. The insurance information will pull right from the payers in eRecord. So you can, the patient will know which are your in-network benefits.
Okay, I'm going to do a quick, oh, sorry, Barrett.
Go ahead.
I was going to wait to see if you had any more feedback on that particular questions before doing one last check on the chat list for any last minute questions that might have come up. Was there anything else that you wanted to add on that answer?
Yeah, I think I just wanted to clarify that the insurance information comes out of CarePaths EHR right now. So if you add any payers, they'll be pulled right to your digital front door and made available for the patients. Now, could you repeat? There might have been another part of the question that I missed.
Sure, no worries. So let me just recap here. So when patients check their benefits, normally they ask if the services will be held in office or inpatient, or in network or out of network. Does the app have options to check what type of clinic we are, and if in network with a particular insurance? Because I guess those rates will vary. So does the app have the ability for you to pick whether you're in network or out of network, or this is an inpatient service or something different?
That's correct. Okay, so yeah, it was the in-person and teletherapy options. Those will be, the differences in the rates will get calculated, and they'll be able to see it.
Okay. Another question related to network payers. If we add an out-of-network payer and bill because the client has a PPO plan, it will show in network, or will it show in network?
I guess it would just show as if you're billing the payer, it would just show a pair that you can bill with. So that's a really good point that you might be billing with a pair that you're not in their network. So we can definitely highlight that. We can definitely highlight that when they're looking at the insurance payers.
Yeah, that is good feedback. And then I have a question about EAP. The person who entered that question, I'm assuming you might be talking about employment assistance programs. Is that something that will show up in the dashboard, Barrett, if they check benefits?
At this time, it's only tied to the payers, but that's a really good point. I do believe we capture which of our practices to participate in EAP. So if we have the data in eRecord, we could definitely pass that on here as well. That's a really good recommendation.
Okay, we'll definitely make a note of that. All right, so that brings us to the end of our question and answer. If you guys are still typing your question, feel free to send them. This meeting is being recorded and we're gonna collect all those questions towards the very end and your names. So if we didn't get to your question, we're gonna follow up with you via email. I've already sent a few messages to some providers about their specific questions. And again, if you need to contact us with a question that we did not cover, I'm gonna put our email again in the chat, which is marketing@carepaths.com. You can send all of your inquiries there. And in the interest of time, we want to end a little bit short so you guys can get back to your busy day. We want to thank everyone again for their time today. We'll be more than happy to schedule follow-up calls with you or one-on-ones if you have any questions about the app. And again, any feedback about the app, any questions you guys have about the app, feel free to email marketing@carepaths.com. Barrett, Maureen, was there anything else that you guys wanted to cover or say before we wrap it up?
I don't have anything else.
I just want to say a big thank you to everyone who took the time today, and for our engineering team for supporting the development of the new app.
All right, awesome. Well, everyone, we're giving you back 15 minutes of your day. We appreciate you taking the time out of your busy week to jump on a call with us. And if you have any questions, again, the email is marketing@carepaths.com, and we hope you have a great rest of your week. Thanks again for your time. Goodbye, everyone.